guys, welcome to my channel, Generic Druggist. My name is Dylan, I'm a pharmacist, and today we're going to be talking about the medication Metformin and go over some ways we can reduce some of the most common side effects that are seen when taking this medication. Metformin, known by the brand name Glucophage, is a medication that is commonly prescribed for type 2 diabetes where the patient's blood sugar is not controlled by diet and exercise alone. It's a very common medication, and in 2022 there were over 92 million prescriptions that were written by physicians for Metformin. Metformin is a very effective drug that will reduce a patient's A1C and help to keep their blood sugar more regulated throughout the day. But this drug does not come without some common side effects. The most common side effect of Metformin is diarrhea. With the immediate release form of Metformin, diarrhea is much more common and occurs in up to 53% of patients, where the extended release form, diarrhea is seen in about 10% of patients. Another common side effect of Metformin is nausea and vomiting. This is seen in around 26% of patients that are taking the immediate release and around 7% of patients that are taking the extended release Metformin. There are more side effects of Metformin, but in today's video we're going to be focusing on diarrhea, nausea, and vomiting, and things that you can do as a patient to help reduce those effects when you're taking Metformin. It's also important to remember, if you do experience any other side effects, then you need to talk with your pharmacist or doctor to see if they could be caused from the Metformin and what to do from there. The first thing that you can do if you're new to Metformin, or if you've been taking it and you've experienced the side effects of diarrhea, nausea, or vomiting, you can try taking Metformin with a meal, usually the largest meal of the day. If you're taking Metformin twice a day and you're taking the immediate release, it's important when you take that first dose to make sure that it's not on an empty stomach and you're having a meal with it. And when you take it at night too, it's good to have a meal as well, just to keep any nausea or diarrhea from occurring in the night. Another thing you can do if you're taking Metformin and you're experiencing these side effects, if you're taking the immediate release, it might be worth talking with your doctor to see if you can try the extended release, because the extended release has a lot less occurrence of diarrhea, nausea, and vomiting, but you still get the same effects of lowering your A1C and helping to better control your blood sugar. So the extended release might be a good option if you're running into these symptoms. If the extended release isn't a good option for you, something else that the doctor can do, or you can talk with your pharmacist to see what they recommend, is to start with a low dose and gradually increase your dose up to what you need to be on as you increase your tolerance to the medication, and this can alleviate some of those side effects as well. So even if you follow these 3 suggestions to decrease the side effects of Metformin, there are some patients who just can't tolerate the medication, and you may be one of those. If that's the case, you probably want to talk with your doctor and see if they can change you to something else that would help reduce your A1C and control your blood sugar, because you might just not be able to tolerate Metformin. But before you do this, I would advise to at least try taking the medication for 2 to 4 weeks, because new patients to Metformin, if they have the side effects of diarrhea, nausea, and vomiting, it does tend to go away after you've been on the medication for a while. So give it a chance. Take it. If the symptoms aren't too bad, just try to make it through those few weeks, and it might be something that, once you've been on it, then you won't have any trouble after that. I hope today's video was helpful. If you have any questions, please leave it in the comments below, and don't forget to leave a like if it was helpful, and I appreciate you watching.